Hello, my name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is the importance of stretching and just general mobility to the spine. I'm going to briefly talk about and review the different areas of the spine and then just demonstrate some gentle stretches that can be done, whether you've got neck pain or low back pain. This is not meant to be an all encompassing review or a diagnosis specific instructions, but just some general ideas of some things to try. Um, with all of this that we talk about and demonstrate, I want you to let pain be your guide. If it feels like it's stretching or there's some tension, that's not necessarily bad. However, if you have true pain, stop. Just let pain be your guide. And even discomfort is not necessarily a bad thing. But if it's true pain, then your body is telling you something's not right. We either need to change our approach, or we need to see a specialist, or need further diagnostic testing. Because all of these exercises are not meant to be painful. They should actually provide some relief from discomfort. Um, so when we talk about the spine, we're going to review real fast. There's essentially four main regions. You've got your cervical region, which is up here. This is your neck. It just goes from the base of your skull sort of down to the top of your shoulders. You've got your thoracic region, which is the trunk. This encompasses all your vital organs, um, your heart, all the good things. And there's some pretty predominant musculature here on the top of your mid back region that supports your upright posture. Um, then you've got your low back region, which this is the area that people typically have discomfort in. Because if you think about it, it's having to support all the body mass up here, whether it's your head, whether you've got excess abdominal mass and excess fat accumulated here, the weight of your vital organs, your liver, your heart, your intestines, all the musculature up here. Your low back has to support everything, so it has to bear a lot of weight and overcome a lot of forces during the day. So people typically have pain here, but it's not uncommon to have pain higher up. A lot of this stuff is postural related higher up. And then you've got your sacrum and your coccyx, which are don't have problems quite as much, but they can. Um, but these are essentially just a bunch of bones that are fused together that interact with your pelvis and your hip. Um, so again, this is just a general overview before we start talking about actual exercises and activities. So let's talk about the neck region first, the cervical region. Unless you've had some sort of traumatic incident like a car wreck or a major fall resulting in hitting your head, a lot of these cervical, the neck related pain is usually postural related, meaning that you don't have as strong support musculatures, whether it's the deep neck flexor muscles, which are closely integrated here on the front of the spine. They're not, you can't see them here, but they're very, very tightly in tone with the front of the spine, or it's a supportive musculature between the neck and the skull, the suboccipital muscles, which if you feel, you can't really feel them because they're deep, but if you feel there's a little bit of a drop off from the base of your skull and there's a little bit of a valley, that would be where they are. Or your supportive neck musculature, your trapezius, your sternocleidomastoid, all the fun muscles up here. A lot of times as we age, as our muscles fatigue, and as our posture decreases, we develop what's called a forward head. where instead of being upright, we have more of a lean to our body, where our head is sticking a little bit forward outside the axis. And a lot of times it's because either the deep neck flexor muscles are weak, or there's a tightness to some of the other cervical supportive muscles. Um, and as they get tighter because of their arrangement and their alignment, they pull a different way, and the force of gravity acting on our body puts a lot of tension on the muscles in the back of our neck. But there's things you can do. Sorry, I had to readjust here. There's things you can do. I'm going to demonstrate a few just gentle stretches that I typically recommend when I'm seeing patients just trying, more just to gauge, does it cause pain? Does it feel good? Is there a tension relief? I'm looking for some sort of pulling or stretching sensation when doing these. The first one that I like to do is not necessarily a stretch, it's more of a realignment activity, but it does stretch a little bit, and it's called a chin tuck. So I'll demonstrate it from the front first, just so you can get that perspective, and then I'll turn to the side and demonstrate it from the side. So what it looks like is you essentially think about making a double chin. You want to bring your chin straight back, and your voice may change too. That's just because of the alignment of your trachea and everything. So you're essentially bringing your chin straight back. You're not doing this, you're going straight back. And think about making a double chin. And then come forward again. So you want to hold it. You want to hold it for approximately 10 seconds or so, like a slow count to 10. It doesn't have to be 10 if you can't tolerate it. That's just a good round number, more for consistency. Maybe complete 5 times or so and take a break. These are all just general average numbers. The important thing is more consistency. So again, I'm bringing my chin straight back and holding it. And then I'm going to do it from the side so you can see. So I've got my normal posture, and then I'm going to bring my chin directly straight back. So another way to think about it is, think about if you had a string or a cable or something directly behind your head, and if you pull on it, it'll pull you straight back. So that's just a good visual mental imagery way to think about it. Pulling straight back. That's a chin tuck. Another one you can do is more for the upper region of your spine. Hopefully you can see my cursor here on the screen. These top musculature, some of the upper trapezius and the suboccipital muscles may be targeted with this. But essentially you're going to nod your head forward. So nod your head first, nod first, and then stretch forward, chin towards your chest. So I'm trying to intentionally nod first. It's kind of a hard movement to sequence, but think about, you do your head when you say yes, you nod, you're getting the upper cervical movement. So you want to nod your head first and then stretch. Okay. And then you can do the opposite. You can nod your head back. So nod and then stretch and hold it. If this one, particularly going back, causes pain, don't go quite as far. Sometimes people get pain with this one because their joints or their discs are getting compressed. And either if you have arthritis or if you have a nerve that's being pinched on, it may put a lot of pressure on that. That's why the nod part is important first, because you may be able to only do that, but at least you're stretching a little bit. Okay, the next one would be what's called cervical rotation. So you're going to slowly turn your head to one side, Again, let pain be your guide. You should feel some stretching, but it shouldn't be debilitating. Um, a little bit of discomfort would be okay, but and then go to the other side. Again, all these hold about 10, like a slow count of 10. Okay. The important thing to know before we go any further with that one in particular, you want to be sure that you're not having any dizziness or lightheadedness or numbness. You've got an artery that goes really close proximation to um, your vertebra down the spine, and that can get cut off, which you don't want to get cut off because then you lose blood supply to your brain, your spinal cord, which in turn can cause some other things. So if you start feeling dizziness or lightheadedness with this one, the turning your head, but really any of these, stop. Um, you may want to also consult your doctor and say, hey, I was just trying to stretch my neck and I was noticing, I was turning my head and I was feeling some lightheadedness, because that could be a sign that maybe something is getting occluded or blocked, or something may not be exactly right, because you should be normally able to stretch without any symptoms occurring. So, like I'm stretching, I feel some tension, but I don't feel dizzy or lightheaded or anything of that nature. That would be an adverse sign. Um, the next one would be a lateral movement. So just tilting the head. So I'm feeling some passive stretching here along the side here. And again, I'm just holding. This one you probably want to hold for 30 seconds or so. The reason I'm saying this is some of this other musculature is a little bit bigger, and it needs a little bit more time to accommodate to the stretch. So roughly 30 seconds. And then you can do the other side. So I'm not turning, I'm just purely trying to tilt my head. So I'm adjusting my perspective and again, I feel it along the side here. Okay, so that's called a lateral flexion. The last one I want to do for the neck is one called a levator stretch. There's a muscle that's called levator in here. I don't have a picture of it. I didn't bring up a picture, but there's a muscle that does a unique movement in your neck that's called levator, and we try to stretch it. So one way you can stretch it is if you're going to essentially do a combination of movements. You're going to turn your head, and then the way I tell people is to think about looking down towards your armpit. So I'm imagining that I'm, for lack of a better analogy, smelling your armpit. Like you really want to feel the passive tension. Um, and again, hold for approximately 30 seconds or a slow count to 30, and then just return. So again, you're turning your head first and then looking down. And you should feel some stretching. I'm thinking about looking straight towards my armpit. That's a levator stretch. And again, with all these, if you start feeling dizzy, lightheaded, a headache, something out of the ordinary that you don't feel in the normal position, stop, and you may want to consider consulting your doctor, because that would be not a normal sign. That could mean that something is getting pressure or not getting enough blood flow. You may want to monitor that. So let's move further down the chain a little bit. When we talk about the spine, we have to talk about posture. And posture is important here in the neck, but also the upper thoracic region. some of these supportive musculature, and even the musculature in the front that's pulling on the rib cage attached to the clavicle, the collarbone, the sternum. Some of that can become tight and pull your spine forward. So there's a good stretch that I like to teach. Let me turn so you can see. I need a good corner. So that's a corner. That's a door and a corner. And you can really do this a couple ways. I like to have a corner because I feel like it's more stable, but you can use an open doorway. And this will be sort of a upper pec stretch. But essentially, you want to put your hands, roughly shoulder height, maybe a little bit higher. You want to have your feet a little bit staggered. So what I mean by staggered is, hopefully you can see my feet here. One foot slightly in front of the other, like a little bit of a lunge. And when I do the stretch, I am going to lunge a little bit forward. Okay. So what I'm doing is I'm putting both hands up. I'm doing that staggered movement, and then I'm just leaning into the stretch. And you should feel some tension in the front of your chest. So when I do that, I'm really trying to be upright in my posture and stretching everything. So I'm leaning into the stretch and holding it. And if you don't have a good corner, an open doorway works too. You just put your hands on either side of the door and lean into the door. This door, unfortunately, doesn't open a lot, so that's why I use the corner. All right, that's a corner stretch. We typically recommend those for people who have neck pain, just a more regional approach. So let's move on and talk about the low back. The low back is essentially the same as the upper back. As you can see, they're all made of the same basic elements. They have the vertebra, you have the discs, which are blue in between. You have different joints in between the vertebra, these things called facet joints, and then you've got muscular attachments throughout. But we stretch the low back a little bit differently. Let me give you a good view. So the first stretch that I'm going to talk about is it encompasses some stretching elements of the neck and the back. And essentially, you're trying to just put passive tension on all the musculature throughout your back. So the way to do that is to lie flat on your back on a stable surface, whether it's a couch or the bed. And then essentially, you're going to bring your neck forward, and then you're going to bring your knees up towards your chest and hold it. So I'm going to demonstrate that, where you can get a good view though. So I'm going to bring my neck forward and stretch, and then I'm going to bring my knees up and just try to hold. Now a modification of this would be just to do the knees, doing one knee at a time or moving to both knees. So you can do what's called a single knee to chest, where you're just bringing one knee up and giving it a little bit of tension. But when you do this, I recommend that you don't pull on the front of your knee, because that can, if you've got some knee problems, that can aggravate things. So I typically recommend people pull below their knee and then pull back. And you can even use a towel to help. If you've got a good towel, you can grab either end and put it underneath your knee, like so, and then use it to provide some passive tension. So that looks like this. This is called a single knee to chest. So There's another one that I like to do, which is more for some of the side supportive musculature, but also stretches the muscles that belong closely approximated to the spine. And that would be doing your knees side to side slowly. So I'll try to demonstrate that. So I'm going to do it from the frontal view and then turn to the side. So essentially, you're going to bring your knees up and lie down. You're going to let your knees fall to one side and let it stretch, and then go to the other side. There's a couple more that we like to prescribe to people because the low back, the hip, and the pelvis are a very, very complex region. And it doesn't show on this picture on the screen, but there's lots of tiny, tiny musculature that is attached from your pelvis to the spine, from your hip to your pelvis. That's all, everything pulls on something and everything puts pressure on something. So we have to stretch some of this other stuff that is pulling or pushing on the spine to provide relief. So there's a stretch. The first one we typically call the piriformis stretch. Piriformis is a muscle. We can't exactly target it, but we can regionally stretch it through doing this stretch. So there's a pure way to do it, and then there's sort of a modified way to do it. The pure way to do it would be to lie on your back with your knees up and then pull one knee upward and then towards your opposite shoulder, like I'll demonstrate. Gotta adjust my camera here. Okay. Okay, so a modified way to do that would be to either just try to get your knee up and then over just a little bit. If you can't bring your knees all the way up, at least try to just fold your knee over. So some people can't really tolerate the movement. So it would be more like this. The last stretch that I want to talk about is called, we typically more call it the gluteal stretch because it targets some of your glutes, your big supportive muscles. But there's other things you're stretching there as well. But just for the sake of compartmentalizing it, you're targeting your glutes more, the supportive musculature to your hip and the pelvis, which in turn can pull on your back. So the way that we typically do that is you, similar to the piriformis stretch, you're going to put your legs up and then put the knee up, and with your opposite leg, you really want to put your ankle on that leg and then stretch pushing down. So it's hard to explain. Let me show you. And then I'm going to push. Oh, hopefully you couldn't see. Sorry. I'm putting one over the other. And if you try that out, you might say, that doesn't really feel like it's targeting what it should. But you have to understand the attachment points of the muscle and what's running where and how things mechanically pull on one another. We typically just call that the gluteal stretch, but it's not exactly. But essentially what you're doing is you're putting your knee up with the opposite leg, you're putting your heel on your knee and then you're pushing down to provide some passive stretch. There's other names for that, but that's just typically what we call it in the rehab, at least within my rehab world. There's one more stretch that I want to do or want to show, and it has to do with the muscle in the front, um, and it's called a hip flexor stretch, which is attached. You have one deep hip flexor, which attaches to the very front of the spine here, and goes down to, well, it kind of conjoins with some other muscles and then goes down to your hip. And the way to stretch it would be to have a solid surface like the edge of your bed or something that's supportive where you're not going to sink down. But the easiest way to do it is to lie your leg just off the side of the bed and let it hang. You can do it a couple other ways, but for the sake of this lecture, it would be easiest to show just hanging off the side. So what you would do is lie on the side and then let your leg hang until you felt some tension. So I'm targeting this right here. And even if you don't feel a big stretch, you're still putting some passive tension on the muscles, which will improve the flexibility, the elasticity, and make less of a pull on the low back, helping with better posture, better alignment, and other benefits. Speaking of benefits, just to sort of summarize, some of the benefits of stretching, in particular for the back, are reducing tension and reducing compression. So your body, as you sit for a while, your body loses its elasticity. You can regain some of the elasticity through a phenomenon called, well, you can regain some of the muscle extensibility through a phenomenon called CREEP, C-R-E-E-P, which if you provide a passive stretch over a prolonged period of time, you can re-stretch some of the muscles. Now you have to do a sustained stretch of approximately 30 to 45, that sort of amount of time, seconds to achieve this, especially with some of the big musculature. But if you're sitting for a while, when you first get up, you're very stiff because you've lost some of the elasticity and those tissues have tightened up, they've dehydrated, and they need to be moved so that you can improve the tone and improve the extensibility and the range of motion. So that's one of the main benefits of stretching for particularly your back, is so you can improve the range of your spine, so you can move in all different directions. The supportive musculature is not as tight and does not limit you as much, but also you're not putting as much compressive force on your discs and the little nerves that come out either sides of the spine. That's about it. Again, this is just a general discussion about some stretching and the benefits of stretching for the low back and the neck region, the cervical spine. My name is George Wanamaker. I'm one of the physical therapists at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.